Tonight's documentary is a tribute to the dedication and courage of team members of the Westpac Rescue Helicopter Service. Crews are located in Newcastle and Lismore, but serve regions far beyond their home bases.
Got a primary and definite Hampton motorcycle accident. Paramedics on scene.
Yep, paramedics on scene.
Westpac 1. KJ to Westpac 1. Thanks, United Base for the Hampton area. ETA 1946, 1946.
You're going to a motorbike rider with a compound fractured leg. Paramedic unit 804 is on scene.
Paramedic 804, Westpac 1.
I don't hear you, just keep coming that direction.
Roger, have a visual, thank you.
Hovering overhead, like a legendary angel of mercy, the Westpac Rescue Chopper is sometimes taken for granted. But come fly with the angels, and you'll see just how vital is the service provided to our community.
We're right ahead of Joffrey. He's got a bit of dust there. He's right underneath the aircraft. Quickly moves away. Still clear the tail. Here's instructions today. Tree out 9 o'clock, 25 metres. Pretty tight there. Still clear the tail. Here's instructions today. Tree out 9 o'clock, 25 metres. Just watching this stuff if he doesn't take off. So it's a bit loose. I got a visual. Still clear on my side. Still clear. I wouldn't mind moving it left a little bit. Hold. Roger. Now you clear down. Put off the ground. Mate, this debris is starting to take off, still blowing away, but not coming towards us. On the ground, it's clear my side. Roger, clearing it out.
You all right, Rob? Smart drop in aircraft.
Thanks, KJ. A 28-year-old male patient, multiple compound fractures of the lower left leg. He has a substantial blood loss onto the ground. He was initially hypotensive. He's now been stabilised with fluid. He's had 20 milligrams of morphine pain relief. There's no other injuries. He's now stabilised on the board and will be moving to the aircraft.
Oh, he's just come up the hill there and he's just sort of lost it. And he's just come off big time and straight in the trees. He started screaming, you know, he was in pain, his leg's broken, and here we are.
KJ Newcastle, Westpac 1. J to Westpac 1. Thanks to Hampton for John Hunter. ETA 2023. 2023, stand by for a patient report from the paramedics. 28-year-old male with multiple fractures to the left leg. He was hypotensive. He's now stabilised with fluid with 20 milligrams of morphine. It's a helicopter. We'll be landing in about 2 minutes. Just left West Wall next on a very short trip. Security has been notified. One patient only for A&E.
As night approaches, in yet another long day for the crew of the Hunters Rescue Helicopter Service, the frontline aircraft Angel 2 has already flown 7 life-saving missions.
Newcastle, Westpac 1. Yes, thank you, right, John Hunter.
The pattern is often the same. Just when it seems time for a break, someone else is in need. This time, the task for the crew is to fly medical specialists called the retrieval team from the John Hunter Hospital in Newcastle to the Mirror Base Hospital.
Received request from retrieval team, John Hunter, to retrieve a baby from Merriwa.
All stations in the Newcastle CTAF area. Westpac 1, the Bell 412 helicopter is airborne. We're tracking 291 for Merriwa, on time to 4,500.
We're going up to Merriwa. We're going to pick up a little baby, 4-month-old baby, with burns to the lower half of its body, and we'll be bringing it back to John Hunter Intensive Care.
The helicopter retrieval team is made up of an intensive care doctor and an experienced retrieval nurse. The teams supervising the transfer of seriously ill patients from outlying hospitals to the John Hunter for specialist treatment.
Well, it's important that, particularly with children, that the patient gets to a more specialist unit very quickly, because you can lose a lot of fluid very, very quickly from burnt skin, and particularly with a small baby, that can happen in a matter of hours, and it can be fatal. So it's very, very important to get the child quickly to Newcastle.
Both.
So he's had an hour and a half. He's had about
120 feet, 100.
Good.
And 130 mils.
But we'll just keep going as soon as we can. And I think you've done everything.
I boiled water and kettle for my baby's bottle, and I was sitting in a big cup, and it had been far away from my daughter, and my son had actually carried it over to her, and it spilled straight into the mattress and into her, so what happened? I only looked at it for a second.
The most important thing we have to do is make sure that the child has intravenous fluids and intravenous pain relief. And for that, it will need a drip to be put into its arm, and it will need to be given probably some morphine and some fluids that are carefully calculated to the baby's weight. They've done all the right things. They've got the drip in, they've got the fluids running, and the child's comfortable, is what you see. So things have been managed very, very well. So it's easy for us now. We just have to take the child back. We've got to make sure that the child's fit to take, and we don't want to have any problems on the trip. It's very hard in a helicopter to do much for the patient, because you're moving around, you're in a confined space, it's dark, and it's noisy. So it's really important that the child is in the best condition possible before you leave the hospital. With also in the back of your mind that you need to get back down to John Hunter quickly too, so you've got to balance the two.
She's going all right. The main thing is that, you know, they lose a lot of fluid through the burns. Yeah. They were just giving her lots of fluid, just like they were doing up in Merriwa. And when we get down to John Hunter, we'll take her to the emergency ward, okay? Yeah. And then we'll see how she is, and if she's well enough, she might be able to go to children's wards. Otherwise, she'll go up to ICU with us, but she's not doing too badly, really.
Newcastle, Westpac 1.
Yes, thank you, arriving at John Hunter.
Nothing thrills the chopper crew more than a positive outcome for their efforts. Baby Michaela was discharged from hospital 5 days later, with nothing worse than scars that will heal with time.
In the base, we've got a primary up at Raymond Terrace.
They're coming.
The wind's on the nose, mate. We'll do a hard out on the left there.
Roger. 8 C's and P's.
Echo 1650.
NR.
Here's 100.
Warning panel.
Got the hopper there. Good engine. To the right.
Okay, 80% now.
For the chopper's other major role, flying injured people from accidents, the aircraft is manned by ambulance paramedics, men and women who have extensive training and experience in road trauma.
We're on the way to a motor vehicle accident at Raymond Terrace involving a small car and a truck. Apparently there's a lady substantially injured in this accident, and we believe that she's got head injuries. The ambulance officers have got on scene, and we've actually requested the helicopter and the paramedics to attend. So when we get there, we'll be able to assess the situation and work it out from there.
Car's gone into a truck.
So the person's out of the vehicle, are they, or?
One's still in, I believe. I don't know where the driver is.
Yeah, I'm right with that, mate. Okay, how are you, man? Donna, 73-year-old lady, passenger in the car. She was wearing her seatbelt. feeling at the bum of this truck here. Driver's fine, but she's complaining of abdo pain and neck pain, okay, upper back, neck pain. You okay, Donna? What we might do, David, is get her out over here on the bed or something, and we'll just get an IV, I think.
The necessity of why the paramedics in the helicopter were called to this scene is the on-scene ambulance officers have arrived, assessed the patient's condition, and they've felt that it warrants the assistance of the helicopter in further medical treatment.
What we're doing is all for precaution to make sure you're okay. All right? I don't want you to worry, we're here to look after you.
Well, at the present time, the lady still has a substantial head injury, and we've been in contact with the John Hunter to have them on standby, so there's no delay of treatment when we arrive.
So I'm just strapping you now, and we'll take you down to the John Hunter Hospital, okay? Your hubby's coming down.
Clear left. 40 knots on the nose, only 95%. KJ Westpac 1.
Donna's been discharged from hospital and is recuperating at home. Pilots and crew work a 48-hour shift, working, sleeping, eating and living at the rescue chopper base.
We've got a task tonight to take a patient from Newcastle, one of the Newcastle hospitals, down to the Prince of Wales hyperbaric unit. It'll take us about just over 35 minutes to get to the Prince of Wales from here.
This young fella had a steel plate fall on his foot while he was at work up in the mines at Singleton on the weekend. And the wound's gone quite nasty, and he's had to have an operation to remove some dead tissue from his foot. And we're taking him down to the hyperbaric unit at Prince of Wales for some hyperbaric treatment to his foot. He's really quite stable at the moment. It's just important that we get him there quickly so that he can have this done tonight.
First started to look a bit suspect this morning, and he was sent down to Newcastle this afternoon from that. No problems tonight with his operation. There's a letter from Peter Burton in there.
So what happened in the mine? Building a drag line bucket. I dropped a line of metal on it, big steel plate. What are you doing? You listening? Smell blood.
I've got some sort of infection in the foot, okay, and part of it actually died off, so the surgeon had to remove the front part of your foot. Everyone's a bit worried that the infection might spread further up your leg, obviously. We'll do our best to stop that happening. You come down here so that we can put you in our hyperbaric chamber. There's nothing unpleasant about it except, you know, when you go up the mountains or on an aeroplane and your ears pop. Well, at the first 10 minutes or so of the treatment, you've got to pop your ears a few times. They will put a fairly tight-fitting mask on so that you get absolutely 100% oxygen. That oxygen will help your body to destroy the bugs.
5 seconds, we're going. Okay, here we go.
It seems that Jason's got a nasty infection in his foot after the accident, and it's one which we haven't identified the bug exactly yet, but the surgeons at Lake Macquarie are pretty certain it's one of a class of nasty bacteria or groups of bacteria that eat away the flesh and are very difficult to stop from spreading. And the main three ways of tackling that are to give very large doses of antibiotics, which he's had, to give him surgery as required to cut away any of the dead tissue, and the third arm of the treatment is this, which is giving him very high dose oxygen at about 3 times the normal atmospheric pressure, and that overwhelming amount of oxygen will help his body fight the infection. And between the 3 of those treatments, we're very hopeful that we'll stop this infection from spreading any further.
Jason had numerous treatments in the hyperbaric chamber before being transferred back to the hospital in Newcastle. He's now back at work, being retrained as a draftsman.
This job's recovery of a seaman who's suffering from a severe bout of malaria. The ship's captain has requested that we be of assistance to his company to recover that gentleman from the ship, which is approximately 4 miles off Newcastle Beach, to the John Hunter Hospital.
Yes, this is Captain Boss. Good morning, sir. We'll be with you in 2 or 3 minutes. Confirm you have a landing site on your ship. Yes, we have a landing pad on
Landing on a ship can be a very straightforward manoeuvre depending upon the sea state and the size of the vessel. If it's a large vessel with open hatches like bulk ore carriers and things of that nature, and you've got smooth seas, well, there's no real problem. There's no difference to landing on that than landing on a football field somewhere.
Down there, tail's well clear. Clear underneath, and how's it on the right, John? You see it on the right, there's just a couple of bolts underneath the front part of the ship. Okay, we'll just keep an eye on them, clear straight down.
The problems occur when the ship's moving around with the sea swell. The aircraft, this one being a Bell 412 with skids, if you're landing on a metal hatch, you can, under certain circumstances, have the aircraft slide on you. So to preclude any accident occurring, we always maintain the aircraft at flight RPM. That way, if anything does start to happen, we can lift off immediately into the hover and sort out the problem from there.
So who thinks he got malaria? Who said that?
On the ship, we're querying malaria, a tropical disease, so there's a good possibility we did pick it up in Korea. It's a disease that's contracted through mosquitoes. He presented as a man who was very weak, lethargic, very shaky, had a high temp, a history of vomiting, diarrhea, generally just pretty unwell.
Gonna be sick. Step up. Step right. Step left. Step in the rear. Departed the vessel with one patient for the John Hunter, and we'll be landing there in 4 minutes.
Feeling much better than the day of his flight, Moitsul Sadikwai was handed back to the care of the ship's doctor 6 days later. The Hunter Region's Rescue Helicopter Service has 2 aircraft. The second, a smaller Bell Long Ranger, dubbed Angel 3. Both machines are checked daily by their pilots and crews. Nothing left to chance.
Jesus, no. If that comes off, Jesus is going to be the next person you see. Well, yeah, it depends on which way you go. Basically, we wait until the 412 goes out. Once the 412's out on a job, we're the next ones to go. We wait, basically. Lots and lots of waiting.
The small Long Ranger helicopter is manned now 7 days a week, mainly daylight hours, but it does have a certain call-out facility outside those hours. This is a reflection of the increased workload that, which we're experiencing over the last number of years.
Been called by the Single Police, and they've been notified that there's a body which was found at the junction of the Kapiti River and Wallamai Creek.
This is a good 200 kilometres from any major settlement. Quite isolated, really. Amazing to think that the people will be bushwalking down here without any backup or assistance. These cliffs are quite spectacular. You know, they're up to, by the look of things, 2,000 foot high. It's just amazing country. There's a number of considerations before we start an approach in here. First one is wind. That'll determine the direction that we start our approach from. And then we have to consider whether we're going to be approaching into the sun.
Clear on the left. Tails well clear. And main's well clear on the left.
As we get closer, we realise that it's written health in the sand there. And some of the P is actually blown away. We can only see HEL. There wouldn't be any chance of anybody actually seeing it. It's so far away from any capital city that it's not going to get a lot of traffic.
So we came down from where we entered over there, and the first thing we saw was felt written on the sand. Obviously done it a while ago.
Well, the situation was reported to us at the police station at Singleton late today. Some bushwalkers that have spent some time coming out of the national park have turned up at the police station and reported the discovery of a man's body in the park. Initial investigation, it appears that there's no suspicious circumstances. It's a remote area. It'll be fairly difficult to recover the body, and we do have a bit of information on relatives, and at this stage we'll be concentrating on contacting them and then identifying the person.
Either that or he's had a go at some of the lady corner and a floor, I should say, and maybe poison himself with it. We're just on a 6-day walk down to the Colo River we often go down here. It's a great spot to walk, and we're 2 days or so into the walk, and we came across this sandbank here, and the first thing we noticed was this great big sign saying help, written in the sand. Very soon after that, we found the body. Came as a complete surprise. We'd never really encountered many people down here before, let alone dead ones. He didn't look like he had done any walking at all before. The pack was very old. It's just a cheap day pack. He didn't have any maps with him, no compass. Obviously completely unprepared. There was no food anywhere to be found on him or his belongings. And I couldn't even find a pack of matches or evidence that he'd lit in a fire. Maybe he lost his way and saw the river and came down because he was thirsty, I'm not quite sure. And once down here, he was unable to find his way back out again.
So it's a shame we're not here picking someone up.
The man who died at this lovely but lonely spot was later identified as 29-year-old Stephen McElwraith of Bathurst. A coronial investigation could not determine the actual cause of his death.
Okay, all right, I'll let the crew know. We'll get ready to go with our water gear, and we'll let you know as soon as you're ready to lift off. Okay, mate, thanks very much. Ta.
The role of the rescue crewman, he's probably the most important member of our team. He's the guy that you see hanging off the winch cable. He's in the surf, he's on the cliff face.
We believe the patient still to be alive, but has not been confirmed that it's capable.
Roger, and how far offshore is it expected to be?
Thank you. At this stage it's on the rock, but there is some concerns of the tide coming in.
Roger, Newcastle Westpac 1's on Channel 10. Roger, Newcastle Westpac 1's reached Penny Beach and we're investigating.
Visual. I'll just turn it to the paramedics to have a quick look too.
Police believe it's a deceased, but
you'd have to ascertain whether he's dead or alive, man. Okay, I don't think there's any option to do a winch.
Yes, I agree. We need to put somebody down there.
The air crewman creates a word picture for the pilot. Basically, that means that his word picture is clear, concise, and straight to the point, and the pilot does exactly what he says. The pilot flies on his commands to carry out a landing or a winch.
Right 3 and hold there. Parliament off their position's good. Clear to hoist. Going down past the skids. Hoist good. Parliament walk their position's good. And on the way down. Okay, now move right 2. Clear to move right 2. And hold. Approaching the ground. On the ground now. The guy is definitely deceased.
The rescue crewman, he's working in all the worst conditions. We're upstairs in the helicopter. And basically he's our representative. He's probably the most important member of the team when we're doing a stretcher winch. He has to actually make sure the patient is put into that piece of rescue equipment correctly. He's responsible for that patient until that patient actually gets back up into the aircraft. So his role on board the aircraft is not taken lightly. It's very important.
Westpac 1 standing by. Roger, sorry about that. We've been a bit busy. We have landed at Penny Beach adjacent to the ambulance car with a code 4, and we'll be offloading that code 4.
Morning. Best starting at 3 o'clock in the morning, Cody.
You sort of go to bed half waiting for the phone to ring, then always the night when you want to have a good sleep, for sure you'll get the 3 o'clock call for a transfer or a job somewhere, which breaks the sleep and makes you rather tired the next day. You get used to it. By the time we walk outside in the fresh air and push the helicopter out, the mind's ticking over and you're ready to go. Off to Gosford Hospital, down the Central Coast. And first of all, we'll be going to John Hunter to pick up the retrieval team, and then down to Gosford, pick up the patient, and back to John Hunter.
Good morning, KJ. Westpac 1 Airborne from base for John Hunter Hospital. I'll pass an ETA for Gosford Hospital and depart John Hunter.
We're on the way to Gosford Hospital to pick up a young lad who's fallen off his balcony of his parents' home, and he seems to have a head injury.
55%, 80%. Up we go.
The main reason we're picking him up is that Gosford Hospital doesn't have a neurosurgeon. So we're picking him up so the neurosurgeon up at the John Hunter can have a look at the scans of his head and himself and see if he needs an operation.
Gosford Security, Westpac 1, we're coming into land this time.
Building renovations to their home in Mangrove Mountain, and a balcony without a railing, and unwitnessed accident. Apparently fell about 3 metres onto a concrete surface and was unrousable for about 10 minutes after.
Got a bit of swelling there, isn't it?
Yeah, a little bit of a facial ventricle.
Everything is really well organised. Patient looks ready for transfer, and there's very little we have to do but make up our drugs to keep him asleep for transfer and get him on our monitors and take him away. He's got a little bit of blood in his head, and it's between the skull and the brain, as it were. And Dr. Christie might feel that it would be helpful to remove that blood to relieve the pressure. Now, at the moment it looks very small on the CT to me, but I'm not a neurosurgeon. I think it's important to be honest with the relatives, give them as much information as you can, and give them an opportunity to ask questions. If they've got anything that specifically worries them, it might not be something you think of to tell them, so it's better to let them ask you. They might put in a device that's a bit like a tube where we can monitor the pressures in his head to see how he's going, okay? Well, the nurse's main job is to draw up all the drugs and connect the patient to all the monitors. She talks to the nurse at Gosford and finds out things like what his last set of obs have been like and what sort of stuff they've got attached. Yep. See you in Newcastle. Okay. Drive safely, okay?
We'll be at the pad in approximately 10 minutes to 5. One patient for ICU.
Well, he's been quite stable throughout the transfer, but as I say, you can't really tell with head injuries. It's a bit of a waiting game. It depends on what the CT scan looks like initially, but it also depends on how he goes over time.
The presence of a retrieval service gives people from smaller centres and valley towns the equivalent tertiary level critical care that the people of the Greater Newcastle area have. So in a way it's taking the hospital to the patient, and as such I believe it's a very valuable service.
Radio Westpac 1 started base on medical retrieval from the Cessnock area. Yeah, there approximately 1.5 hours and we'll notify our return. Thanks.
Off to Cessnock now to pick up a gentleman who's having a lot of breathing troubles. Apparently he's got quite severe asthma and emphysema, and he's an elderly gentleman, and he's in quite some difficulty.
Pulmonary edema, white cell count 30.
Yep. Are you able to speak?
No.
It's too hard, is it? Have you ever been this bad before? The first thing to do is assess the patient and decide whether he needs to be ventilated on a, if you like, a life support machine for the trip down. It's important that we don't have any problems in the helicopter, and we don't want him to stop breathing in the helicopter. So we need to make sure that his breathing is secure and that he's safe for the trip. We're going to do another blood test in a couple of minutes, just as similar to the one you had already. All right, and then we'll check the result of that, and we'll probably get moving soon after that. You see the lung fields are a bit white there, where they should be all black, nice and black, and it suggests that sometimes there might be some fluid on the lung. The other thing is that it's quite likely he's got lung infection, and that shows up here. He seems to be in reasonable enough shape that I think I'll be happy to take him back as he is. It's important that we get him down to Newcastle because he may need ventilation at some stage. If not right at the moment, he may need it in the near future. And the facilities for that are available in the city hospitals, but not very difficult to do that in the country hospitals.
Godfrey Alford was taken to the Mater Hospital and is now back home in Singleton. Young Anthony Lucci, who was transferred from Gosford Hospital with a head injury, is well and also gone home to his family.
Newcastle, Westpac 1. Come here. Thanks, Westpac 1.
We're on our way to a report of a person falling over at the 20-metre cliff at Crowdy Head.
Sheer cliff. He is laying currently on rocks. It appears they are inaccessible from anyone to actually access him. It may require a winch.
If you can get the extenders out, set up the packs. What we'll be doing if we do have to do a winch, we'll do our standard procedure, will be the paramedics down with the packs, then send the dual extender and the gear extender back up to the aircraft. I'll then put Barry down with a stretcher and we'll go from there.
At this stage, they said the man is on the rocks, he is moving, but he's around about 20 metres away, so they're looking through binoculars at this stage.
Newcastle Westpac, copy.
Westpac 1 copy, just to the south of Crowdy Head. Westpac 1's approaching scene.
Newcastle, thanks Westpac, on scene 1802.
Oh, I got him there. See the bike, doesn't it?
6-4.
Have they got a person to it? Not yet.
Well, the cliff, it certainly looks 20 metres, if not, maybe even greater, as we approach the scene. And you can actually see the rescue personnel on the cliff edge. And as starting to be winched down, we can actually see that one of the volunteer rescue organisations personnel are abseiling to the location.
Okay, just move the paramedics over. They're off comms. Okay. Moving over now. Moving on to the skids.
You're always apprehensive as you just exit the aircraft, but you know that you're basically in the hands of the skill of one of the best helicopter rescue services in Australia.
Approach is alive, good, speed's good. Well crew in the tail, well clear right. Keep moving forward, 5, 3, 2, 1, and hold. Tail's clear, main's clear, well clear right. Keep leaving the skid, hover's good. Height's good. Well crew in the tail, crew in your range. On the way down, drum check. 20 below the skids and 30 off the ground. Drum check, well crew in the tail, crew in your main. Well clear right. 10 off the ground. Drum check. Thumbs up. Give it to the spike cable. Still well clear in the tail, crew in your main. Well clear right. Retrieve the cable. Cable's on the way up.
We can only assume at this stage that the young person was walking along the cliff edge and has slipped and fallen onto the rocks.
As we approach the patient appears to be showing signs of being deceased. Massive injuries that appear to be incompatible to life.
Westpac portable to Westpac 1. Do we have the light pack 10 monitor drop down to us, thanks?
It's very upsetting, especially when you get a job like this. It's a young male in his early 20s in the prime of his life. And one of the things that makes it further distressing is we've had further information that the young fellow's parents actually witnessed him falling over the cliff. You can always relate to your own family situation. We go to a picnic and that could be one of your children. Well, basically in our job we've got to basically let it go and on to the next job. Now we've been called to a baby who's been injured in a motor vehicle accident at a place called Moral Creek. Well, now our train of thought now is thinking about we're going to a child, so now we've got to think about some of the problems that we may encounter with a child. No ambulance officer likes to go to children who are in trouble.
AJ, have you had a report from the
the report from the residents indicates that the child is now conscious and crying, although it still appears to be in a lot of pain.
About 4,000,
What we heard on the conversation with the pilot and the chief crewman is that we're flying into a black hole approach, which is there's basically no light, which makes you very apprehensive, but we have complete faith in the pilot and the abilities of the crew.
Maintain this side, come straight over the top.
Okay, coming in.
Bring it to night, turn out to my left. Bring it left. Onto the road, I'll just see if I can see the power line.
We've got wires on the nose here.
Okay, going across the nose there. Bottom. Move forward 3. Keep moving forward 2, 1, and hold. Well clear in the tail. Keep moving down 3. Keep moving down 2. And clear to come straight down.
Come down.
Well clear underneath. Tail's clear, main's clear, well clear left. And I'll get the paras out.
What's happened? She's been in the car, unrestrained, has actually rolled over. She's been rolled around inside the car. She's got multiple body abrasions on the right-hand side. She's conscious, but she's drowsy, okay?
Quite worried at this stage because the patient has been in a high-speed MVA, which is a criteria for treatment at a paediatric unit. The patient has been unconscious, is now conscious but still drowsy.
All right, well, what we're going to do is pop down the John Hunter.
Oh, right.
But children always are the innocent victims, and what makes this job especially sad is it's the little girl's 2-year-old birthday today.
And
8 days later, this very lucky baby was discharged from hospital with no lasting injuries.
We've got an indication of a number 2 failure here, and coming back here, number 2 failure has, number 2 engine has definitely wound down. We have a failure. To reduce RPM switch speed to maximum. Airspeed 45 knots or 70 knots is critical. The fire, no signs of fire. No signs of fire on number 2. Good stress call. Yeah, we'll put out a pan call.
We rate safety is extremely high on our list of priorities, probably the highest priority of all. And intrinsic in safety is pilot and crew training. Specific reference to pilot training, we go well above and beyond the minimums required by the Civil Aviation Authority by many-fold. We pride ourselves in really leaving no stone unturned, if you like, as far as pilot training goes.
And a reserve, number 2 confirmed, number 2 confirmed. Rest of the checks for engine shutdown. Good.
Westpac 1, started basic paramedics on board for MVA in the Largs area. Can you pass on further details?
At this stage we've got 1 patient, code 9. There will be 3 patients in total.
You've got the area visual, and just advise below 60 knots with doors. Okay, got 20 to run.
The first thing we look at the scene is to assess the whole overall situation and what other services are available there. If an ambulance is already there, we will usually go directly to the ambulance officer and ask them what they've found and what they've done in the first instance.
First patient female, accessible, chest injury but fully conscious. Both patients appear relatively stable this time. Deviator release of the second patient approximately 15 minutes.
The main role of the paramedics is to extend the treatment already instigated by general duties ambulance officers and ALS officers. We have a few skills available which periodically are required above and beyond what the normal ambulance officer can do. That specifically is our area of expertise with serious multi-trauma or medical emergencies.
A bit sore, okay? Now we can give you something for the pain if you like.
The aircraft has the capability of being configured to carry 4 adult stretcher patients with various levels of injuries.
Westpac 1 departed Largs with 2 patients on board, 1 female, 1 male patient for the John.
During our flight, we will assess the patients further as we're treating them. We will then contact the John Hunter A&E department and notify them of the number of patients we've got coming in, their injuries and specific treatment that has been given, so they're forewarned about what to expect.
Roger, Newcastle, Westpac 1. KJ, Newcastle, Westpac, you landing, are you? Westpac 1, affirmative.
But in the 30-minute drive by road.
The handover is quite important because we are the eyes of the medical staff, as it were, at the scene. We have to describe what happened, the mechanism of injury, what we found with the patient when we were on the scene, what happened during and after treatment, what happened in flight, right up until the point we've taken them through the doors. So we are responsible for not only treating but relaying that treatment right through to the medical staff so they can picture what happened from the time it happened right through till they get the patient.
Not KO'd, remembers the whole event. Basically, she saw from the seatbelt injuries across the chest, tender tummy, very tender tummy, bruising under the arm. Both knees came up under the dash. She wasn't actually trapped. It's been a fairly high impact. Complaining of a swelling feeling around her tongue.
We've usually got some notice that there's a serious case coming, a trauma case, and we've assembled the hospital trauma team, which consists of 4 doctors and 3 nurses. The nurses are from our department. One of the doctors is from our department, the others are from intensive care, Department of Surgery and intensive care.
He's got an arterial bleeder in his face.
There are a protocol, a scheme of dealing with trauma cases, first attempts are directed to life support of the patient, keeping the patient alive before going on to other things of prime concern is resuscitation and to maintain life.
Both Catherine and Joshua have now left hospital and are recuperating.
The helicopter service doesn't close down Christmas Day or New Year's Day. And the service keeps rolling on, and regardless of whether it's a weekend or weekday, it's just basically another day.
Oh, there's the phone right in the middle of us.
Westpac Rescue Helicopter Service.
While others celebrate the Christmas New Year week, the chopper crews fly an average 3 to 4 life-saving missions a day. Leaving festivities behind, they'll be at the forefront of each and every trauma over the holiday season.
I've got 333, Westpac 1.
Patients being transported by road to the Barrington Jet Center.
KJ Newcastle, Westpac 1.
We have it as a patient in BT with a BP of 50 systolic initially. We do have a doctor on scene with the ambulance crew. On Bay 252 and Westpac 1, unable to get police in that location within that time frame. Patient in BT with a BP of 50 systolic initially.
Sadly, not every mission has a happy ending. All too often, the men and women who crew the Angels are faced with the realities of death. These hit home even harder at this time of family celebrations.
It's obvious has died on impact, and the other fellow is suffering from head injury. Their quick response is invaluable.
KJ Newcastle, Westpac 1, go ahead. First lady in the water, down to Bay Harbour, headland. Police have been in the water for about 20 minutes. We've got 2 rubber duckies on their way around.
Right 3, right only 3, right 3. Pushing the rubber ducks in now. They're underway by the looks of it.
Can you go in the water and swim to them?
Yeah, I'll indicate to him. Back 5. 4, 3, 2, 1, hold. Put Sandy down, go down 5. 4, go down 4. 3, 2, 1, hold. Sandy's in the water. Okay, he's up, disconnected from the hook, have a thumbs up. Bring your hook up, you're clear to move off.
KJ, Westpac 1. We've winched rescue crewmen to the rubber dinghy. Request from the paramedics that they motor around to Boat Harbour where the ambulance is waiting.
To the right, just so I can keep an eye on those cars. Roger, your car's clear, right?
All we're thinking about is, come on, let's get into this, and hopefully we can revive him, get his heart going again. Sad time at any time for this to happen, but especially in the holiday season when families get together and as has happened here, kids go with relatives somewhere else, unfamiliar ground for a holiday, and tragedy happens. And it just blows you away.
Paramedics and ambulance officers work on the 14-year-old using all their skills to give him every chance. As they battle for a sign of life, a decision is made to take him to the Nelson Bay Polyclinic. A short time later, the young boy was pronounced dead.
Very sad, unfortunately. Apparently the boy's up here on holidays. He only arrived yesterday. Went for a walk on the rocks with his mates. And, you know, at any time it's bad, but at Christmas time it's just shocking. We kind of feel for the families now. You know, there's a family somewhere in Sydney, well, knowing the worst, I suppose, and it's just, I hate it. That's the one bad part about the job that I really hate. But unfortunately, we'll have to. We've all done our best. Everybody in the link at the chain, the people that rescued him out of the water, paramedics getting us up there, the local blokes, the doctor at the hospital. Sometimes, unfortunately, it doesn't do any good. You don't get them back, and it's hard for us when that happens. We've just got to say, well, all right, we did our best, and kind of walk away and forget about it, because there's another job in 5 minutes or tomorrow. But it hurts, and especially when a young boy like that, it hurts. Yeah.
We've departed base with paramedics on board. It's been called to the Seal Rocks area where we've had a report of a 7-year-old boy jumped in the surf.
The difficulty with this job is that you've got to land on the beach.
The tide's pretty high there. I don't want to get swamped by a wave.
The helicopter's great for jobs in this isolated area, as the nearest ambulance is about 30 minutes away at Bulladoola.
There's 3 patients on the scene up there, an adult, 2 children.
I was going north and the other truck was going south. She locked up and gone in underneath the middle of the truck going southbound. He catapulted her straight back and crossed into the airborne in front of me. She's got 2 little ones in the car with her. She's lucky to even be alive, I think.
We'll be leaving here in about 3 minutes. We'll be landing in about 7 minutes, 8 minutes. Thanks.
Calls just keep rolling in.
Bottom line is you never know when, where or who's going to require the service of the helicopter. We've just got to be there, ready.
All stations in the Newcastle CTAF area, Westpac 1, the Bell 412 helicopter is airborne. We're tracking 2912.
People of the valley can be very proud of.
Zone departed John Hunter for Wyong, ETA is 03.
Jason's got a nasty infection in his foot after the accident.
We're offering a world-class service, a world standard.
When I look at him now and think of all the wonderful care that he's got, I think, well, we might have another 5 years together.
Nice hill boat, about 150 metres off the beach. Now ETA up there will be 1607.
Is any officer to do a winch? Yes, I agree. We need to put somebody down there. Break 3, break 2, break 1.
It can be fatal, so I think it's very, very important to get the child quickly to Newcastle.
Thank you, everybody, because it's just, you're doing a wonderful thing and it's for a wonderful cause, and my daughter is better than she would have been if not for your service.
At this stage, we have one patient released with head injury unconscious. We have a second patient, maybe query code 4.
One that's obvious has died on impact.
I don't like to say it, but if it hadn't been for them, maybe I wouldn't have been here today to say thank you.
We've just arrived on that zone. We may have to air freight at least 2 or 3 back roads. We'll get back to as soon as we legally can.
Westpac 1 departed base with paramedics on board.
This stage we've got 1 patient, code 9. There will be 3 patients in total.
First floating in the water, south of Bays Harbour, headwind.
It's a sad time, at any time for this to happen, but especially in the holiday season. It hurts. And especially when a young boy like that, it hurts.
No undercarriage, immediate take off.
So grateful to them because I could be dead.
Westpac 1 departed base, paramedics on board for Murrell Creek or Dillingham.
There's 3 patients on the scene up there, an adult, 2 children.
Good. Little bit of right. You have to concentrate. Your height's got to just stay moving out. Bit of hoist. Keep coming right. Right here. All clear. Keep coming right 8. Right 5. Right 4. Going down past the 6. Height's good. Can't make all clear. 6.
The Rescue Helicopter Service relies on community support. Donations can be made at any Westpac branch.